Hi, Dr. Paul Petrangero, the implant don. I like when I use that inflection, the, okay? Because this one's gonna be passionate, okay? I'll tell you what's bugging me. I'll tell you what's really bugging me. You know, I sent out a little message. I'm a little behind on the filming. That's because I actually do this clinical stuff on a daily basis. And I do the work of 3 different doctors. So I apologize for some of my tardiness, but believe me, I'm never tardy when it comes to this. I'll tell you what's really starting to irk me, okay, is the Johnny-come-latelys, okay? The rat whores that are in my field, okay? Now let's talk about what we mean by my field. My career, my life, my passion, okay? I've been doing this for 30 years, over 30 years. And I have been very lucky in one way and very unlucky in a lot of other ways, okay? I've had everything that can happen to a doctor happen in the field of dentistry. I mean, I've been rich, I've been poor, I've been rich, I've been poor. I've had my licenses screwed with. I've had people take shots at me. I've been sued. I've been an expert witness. I've had it all, okay? And I'm telling you, I consider this my field, okay? This is my life's work. I've written 95 clinical publications. I didn't have any ghostwriters. I didn't have residents writing these papers for me. Me, okay? I wrote them. I've had some co-authors, but I've done the brunt of the work, okay? Presentations around the world. I've put them together. I didn't have residents putting them together or doctors that want to be something else. I put them together, okay? Now, I'm not the only one. There's a lot of people that do a lot unbelievable things for dentistry and for surgical dentistry and have spent their time and have been really good. But I got to be honest with you. I'm starting to get sick. I'm starting to really get sick about this. And I'm starting to get pissed off. Because it seems that now that everybody is a Johnny-come-lately expert. I mean, I'm talking about even people that don't have any clinical experience. What are your credentials, bro? Okay? Seriously. Because you can put up a social media page, doctor up some followers to get your numbers up, play some games back and forth, get some people together, make a couple podcasts, do this or that. Now all of a sudden you're the man. You're the woman. You're the boss man. Have a couple meetings, make a little money, and we are now the new trend in education. It's interesting. Interesting to me. Because you know what's really funny? When a lot of these people were playing with their G.I. Joe with the Kung Fu grip, I'm in the blood and guts of the mouth, coming up with new surgical techniques, one of the pioneers of immediate tooth replacement in the aesthetic zone. And those of you out there know, you know the arrows I took for that. You know how I got blackballed. You know the fight that I've been in to step forward in this field and be on the forefront trying to make our field get further ahead with multiple procedures. Do you want to go through them all? Let's start with PRP. Let's start with immediate restoration of implants. Let's start with autogenous blocks. Let's start with allogenic grafts for different companies. Let's talk about one company, okay, that screwed me out of a ton of money, still uses my aesthetic slide deck from 15 years ago when they go to give a presentation to new doctors to buy into their implant systems. That's a whole nother discussion, okay? But you know, I really think that people need to be aware of what's going on in our field, okay? And I certainly don't have all the answers, but I'll tell you what I'm not gonna do. I'm not going to stay quiet about some of what I've seen happening in the last year, okay? And you know, education is wonderful, and education is important. And once we stop learning, and once we stop trying to learn, we should no longer be practicing in our field. But when education is being controlled by people that are not doctors or surgeons or prosthodontists or orthodontists, but controlled by business people that are running things to make more money for themselves, then education is lacking. That's not right. That's not what we're supposed to be doing in our field to learn. Can you make a lot of money teaching people? Can you make a lot of money hosting big programs? Of course. Why wouldn't you? All right? It's a gold mine. You get 50 people to sign in to pay $300 to watch somebody do something for an hour. How much money is that worth? You get 500 people coming to a meeting that pay $700 to go to that meeting. How much money is that worth? And then you start talking about sponsors. Then you start talking about distributors. It's crazy. It's really crazy. But that's fine because that's the business side of this stuff. But what we're losing sight of that I see, especially in social media, and I have 2 pages. I have a Start Smiling Dental Implant Centers page, and I have an Implant Live page. We have 5,000-6,000 people on Start Smiling, and we'll be at 20, 25. We'll be at 50,000 by Christmas time, okay, with Implant Live. Now, I ask you a question. Am I ashamed of that? Hell no. I love it. Are you kidding me? Because that's one of the platforms that allows a guy like me that usually gets in arguments with people because people get jealous of me and I quote unquote, I scare people. I'm risky, okay? Oh, he's this and he's that and he's this. It's okay, keep coming. They've been doing it for 30 years. You ain't gonna stop now. You certainly ain't scaring me. Because you know what? I don't care if you talk to me. I don't care if you ask me to come to your meeting to lecture. I don't care if you ask me to be part of your new system. It makes no difference to me. I deal with people that I deal with that are loyal to me, that I'm loyal to them, that respect me, that I respect them, that respect the level that I'm at and what I've done for this field and how I perform surgery and how I document and how I publish and how I build my own credentials. Okay? Those are the people that I want to talk to. The Johnny-come-latelys that come around, that use the situation for their own benefit and then try to spit people out, those are the people that I'm talking about. And you know who you are. So here we sit. Here we sit. I wish I had a little fireside in my cigar and my scotch because this would be even better because then I become more philosophical, which I don't know if we should really do because we don't want me being philosophical. We want me being right in your face, which is where I'm my best. So you know what? The public, our field, dentists, oral surgeons, periodontists, prosthodontists, orthodontists, endodontists, you guys got to pay attention, okay? Just because somebody has a bunch of followers or somebody comes up with some new thing or whatever, that doesn't mean they actually know what they're doing. That doesn't mean they actually do the procedures themselves. Are we going to listen to somebody that's done a few different surgeries and now because he's got the time to spend to make videos and put these up that he's the real deal? I mean, are we going to listen to people that just because they've got a bunch of people following them or doing something, they're all of a sudden an expert? Man, I don't get it. I don't get it. There's the business side of dentistry, and then there's the relationship side of dentistry. There's the business side of education, and then there's the relationship side of education. And then there's the dollar and cent side of business, and then there's the who can pull off the clinical stuff side of education. And when we're having people control education or teach education that don't do procedures, we are seriously missing the boat of where we're at. And I'm telling you right now, I haven't forgotten, nor will I ever forget, nor will I ever stop. Because as long as my faculties hold up, I will not stop publishing. I will not stop documenting. And now that I'm starting to get people that are paying attention, I will not stop calling people out. Because that's all there is. And I don't care what you think of me. I don't care if you like Paul Petrangelo. I don't care if you think that the implant don is the biggest asshole who ever came on the face of the earth, because in a way I am, okay? But in a way I'm not. And I'm telling you, it is going to be my personal goal, my personal vendetta, that as I grow and that as things get bigger and as that we get more audience listening to what I feel is right, things are going to start changing. A little bit at a time. That's what change is. You know, when I started doing immediate restoration of implants in the aesthetic zone in 1996, that's before these guys with the Kung Fu grip were even born, but in 1996. And I was one of the guys that would get up on a podium and then I'd have people telling it didn't work, and I had people talking bad about all this. You know, and then watching it over the years now become adopted into normal treatment protocols. And it should have been 25 years ago. The problem is the guys at the top of education are making so much money. They didn't want to retool their slides because they couldn't retool them fast enough to catch a guy like me. So they kept the field down. And they kept bringing people into big educational forums where they're spending $15,000 to go to a course for 10 months, and they didn't teach them anything. They took their money. They'd buy them a suitcase or they'd buy them some, or whatever. It was all baloney. But the bottom line is that's not what education does. But when I started doing this, okay, what me and other people, once again, I'm not the only one. I'm not saying I'm the only person. There's a lot of good people that do a lot of good education, and they have a lot to offer our field. But there's a lot of scam artists out there, and there's a lot of people that think that they're altruistic in a above, you know, almost like in a heavenly way, that they've got some great forum or some great course or some great thing in la-di-da, let's all follow me because I got the numbers, but I'm going to tell you you're a jag-off and I'm not going to deal with you anymore. Yeah, well, here you go. Bing, right there. That's what we do on the south side, okay? And remember, I'm from the south side. And there's only a couple places in this country that can claim that kind of a neighborhood. And I'm glad I'm from the one of them. But anyway, let's go back because I started to rant a little bit. Allowing people, okay, to educate you that don't have credentials for education is where the problems begin. One of the reasons we've got all these failures in our field, I have failures, I am not perfect, I can fix my own failures. But one of the reasons we have all these problems is that we've got people teaching people that need the instruction themselves. I mean, when we start making clinicians feel comfortable to do things before they've had some of the base surgical experience to do those procedures, this is dangerous, okay? What's even more dangerous is that the regulatory boards and the regulatory commissions for a lot of these organizations aren't paying attention to this. It's the old boys club. It's who smiles the best. It's who's going to bring in the most money for the organization. I mean, this is almost ludicrous. It's ludicrous. Okay, it's ludicrous. I would like to see all of our dental meetings that we have, all of the people that do the main presentations and lectures. Okay, what I'd like to see is, what were your credentials to be selected for that lecture? What did the selection committee of the meeting? There's a big 3-day meeting where you're going to have 30 main podium presentations. There'll be 700 people at this meeting. What did the selection committee for the organization do to select you? Was it 5 or 6 old boys in a room having cigars and drinks and saying they're going to put their buddies on so they can get a check from their buddy for here or there? Or was it actually is, let's see what this doctor has done publishing-wise. Let's see what their track record is. Let's see what kind of presentation they have. Is it a new presentation or one that's been recycled 30 times? Do they actually do the procedures that they're going to get up and talk about? Or is it all politically and monetary driven? I can tell you right now it's politically and monetary driven, but that's a different story. But that's not going to change. It's not different than a lot of schools. I mean, if I knew somebody that was going to go to dental school, and I'm out of the dental school educational tree, so I don't know that much about it, but I do know the politics behind it. You know, a lot of people graduating dental school never do certain dental procedures, but yet they get a license and are able to do them. Now, once again, this is not just dentistry. This is everything. I mean, you know, how can you possibly take a doctor, a young doctor, put them through 4 years of dental school, and then graduate them to go out in the field with no residency or no further education and expect that they can know where they're really going to go to do it? When half the people teaching them don't really do the procedures on a routine basis. How do you teach people when you don't do the procedures? I don't get it. It doesn't make sense. It's ludicrous. So anyway, let's go back to this standpoint. Let's go back to the G.I. Joe with the Kung Fu grip, okay? Because that's what I think is credibility. So, moving forward with my little podcast series here, The Implant Don, and I really thought about that a lot, The Implant Don. I really thought about what I would be talking about, to be honest with you. Moving forward, I think what we have to do is we have to really understand the amount of bullshit that is in our educational field and course offerings that are out there everywhere. And understand that the people that should be teaching clinicians should actually have, it's almost like renewing your license. You have to have a certain amount of CE in order to get your license renewed. I think we need to change the law. I think we need to say that people that are offering courses or teaching courses or offering lots of stuff that they do online or whatever, I think we should actually have a credentialing board in the United States or wherever that you have to apply and present what you have to this credentialing board before you can actually teach somebody. You know what the number of teachers, if the number of teachers were this big, by the time you got done doing it, the number of teachers would be that big, okay? Because it's almost comical. Do you understand? This is silly. And then we wonder why we got problems. We wonder why we got implants falling out of everybody's head. You know, you actually got people that think that just because the computer tells you you can do the surgery this way, that you actually do the surgery this way. It's called guided surgery. Now, guided surgery is nice. I think there's a place for it. But the problem is, what do you do when that doesn't work? Okay? And anybody that does dental surgery in the mouth will tell you that you deal within that small hole, okay, and try to get your fingers in there and try to have the manual dexterity and try to have the knowledge and the hand and eye coordination to actually have that happen and pull that off. is a lot different than trying to do something with a machine or a computer telling you to do it. So anyway, make a long story short, I'm going to conclude this one episode of the podcast by saying the amount of bullshit that's in our educational system, private educational system, is almost mind-boggling. And I hope that other individuals like myself that take a lot of pride in the surgery that they do on a daily basis and does surgery on a daily basis, and it has the wherewithal to put a publication together and has the wherewithal to submit it to a board where they can review your publication and accept it or decline it. And people actually treat patients and get positive results and do procedures that start making trends in a field or trends in a certain discipline and change those trends over years. Those are the people that should be doing education, not the Johnny-come-latelys. So anyway, for the Don, as they say, grazie tande. And I'm looking forward to the next one because we're going to the next level on the next one. And I've been nice so far. I'm not going to be nice moving forward pretty soon. Okay, so thanks everybody. I hope you enjoyed it. And stay tuned because we're going to have more coming.